So anyway, hi, this is Emily. I'm recording this. This is our PS Free as you want to be hangout on Mitrofanoffs versus suprapubic catheters, or SPCs. And so here we are. And thanks to Doris. Doris is our first expert of the day. And you're getting the Mitrofanoff, right? Or you already have it, sorry. What made you decide to do that instead of an SPC?
Well, I knew that I couldn't tolerate an intermittent catheter because I started trying Foley's all through the 90s, and I just couldn't tolerate them. It was it would be in me for 2 or 3 days, and I'd have an infection, and I had to pull it out. So I knew I wasn't going to move, and it's still even with the suprapubic, it's an intermittent catheter. And it was my bladder that was hurting, not my urethra. So I just knew that wasn't going to work. So I found a doctor that would do it, and I didn't even know it existed until he told me about it. And I went, well, I want it. I got to have it.
Cool. And Marty, what do you want to do? What are you thinking of doing? Are you going to do SPC or Mitro?
I don't know, because as far as I know, there's pros and cons of both. But the pros of one are the cons of the other. So it just depends. Obviously with the SPC, you have to have it changed, and that can be quite painful, but it's reversible. Whereas with the Mitro, it's not painful to put the tube in and out, but it's not reversible. So if it doesn't agree with me, I'm stuck with it.
Right.
So I'm not sure.
Okay.
I want the SPC at the moment, because then, one of my PAs said, if it works, then I'm fine with it, and it doesn't cause infection after infection after infection. It's more likely that the Mitro is going to be the same, and then I can have that done permanently if it works. And then if it doesn't, if I get infections, I can just take it out and forget about it and go back to not being able to pee.
I hope we never have to reverse it. I really don't. How about you, Kat? What's up with you? What are you thinking?
I'm the same as Marnie. I just want to do my research first, because I don't really know what's out there, and I want to hear what other people have had done, what other people's experiences are. I just don't know.
Right. Well, I have pretty much settled on the SPC because I'm a surgery phobia person. I don't want to go under a big surgery. I don't have time to take off of work to recover. And I just don't want to do a big surgery. Although I think I like the Mitro better. I think it's cleaner. I think it's neater. I think there's a lot less hassle involved with it. I just feel like it. I think it's overall. I don't know. It's kind of one of those things, because the surgery, I think, is the hardest part. That's the biggest hurdle. And then once you're over the surgery, the maintenance of it, I think, is a lot. And we can talk about that with Doris, because I'm more I was thinking more about the maintenance of it. Maybe in the end you'll save less time because you don't have to go in through for catheter changes every month. Mm-hmm. So if you actually totaled the time, the Mitro might be a better deal in that sense. You're kind of putting all your time up front.
Yeah.
So that's kind of why the Mitro is still kind of in the back of my head. Because the idea of finding someone to change it, I don't know how I'm going to do that. I don't know how I'm going to find or train someone to be able to study themselves enough and do the change. So that's kind of where I'm at.
Have you ever used a Foley?
No way. I don't want anything in my business.
But you need to try it.
Why?
You need to know what it feels like, because it's going to feel the same. It will feel the same. The two won't come in. It won't be entering in the same place, but it's going to be laying in your bladder in the same place. So it's going to feel the same. And yes, it will bother you sexually. I'm sorry.
But they say that it doesn't, though. The people that have them say that it doesn't bother them.
Maybe I'm just extra sensitive. Because I've had to have an intermittent catheter. Okay, well, to caveat my whole success story, the truth is every 3 to 5 years you'll have to get it. Well, I don't know about the Mitrofanoff because I don't have that. But what he did to me is the same as the description as the Mitrofanoff. And about every 3 to 5 years, I have to get the scar tissue cut away because it starts scarring down and it starts getting difficult to push the catheter in. Now, if it weren't for muscular dystrophy, most people could still do it, but I can't. I'm weak. So he opens it up every 3 to 5 years, but that's day surgery, half an hour worth of surgery, your whole day ruined because you didn't get to eat all day. But that's all it is, it's in and out.
Okay. That's not terrible. So why don't you talk a little bit about the recovery period and stuff. I know you said it took you a while to recover from it and stuff like that. So
it did take me a month in rehab. If I had had family members or somebody that was willing to be around me a lot, I probably could have come home. But I don't, and I needed to be in rehab. In fact, I was pretty sick 2 weeks later when they moved me to rehab. But then once that was over, it was just over. And there was some pain issues for about a month after I got home. And here's my memory of 9/11 is that I was out of pain for 1 week when 9/11 happened, and then the whole world blew up. But so that, I guess maybe 2 months. I mean, the rehab lasted a month, and then there was some just getting used to equipment changes and how I was going to handle it. And once I finally I knew it and I was comfortable with it within 2 months. But since then, I don't have to worry about peeing. I can go out and eat, which I could never do. I had to know where the nearest accessible bathroom was. And by that point in my life, I wasn't able to use an accessible bathroom. I had to be at home. So, and now I can't even get on and off the toilet at all. So but I don't have to.
Yeah. I want to quickly just admit my mistake here, because Kristen's not. I keep forgetting that Kristen can actually type in her chat, and so I have this is the worst part about my facilitation skills. I am terrible with chat and video and all this stuff that I have to do. So Kristen said, when you ask for my opinion, I don't have one, but in the future I will probably get one. I know almost nothing about it though. So that's good. So right now, as we're talking about the Mitrofanoff, and that's the full-on surgery where basically they kind of reroute stuff. So will you explain what they rerouted, Doris?
For me, I didn't have an appendix because I had previous abdominal surgery and I don't know if they still do this. I hope they don't. But it used to be when they opened up your abdomen, they took your appendix because they thought it was useless. Now when they know that there's uses for it. So for me, he took part of my ilium and moved it, actually wrapped. He formed the pathway with my bladder. He took my bladder and folded it over an 18 French, actually I think it was bigger than that, I think it was 22 French catheter Foley. And so he pretty much destroyed my bladder and then took this part of the ilium and rebuilt the top of my bladder. So there would be a pouch to hold urine. Now, the most important part of your bladder is the trizone, which is the bottom part. So you get the sensation to pee and a fullness at the bottom part, and then your ureters come in towards the bottom part. So you've got the triangle between the urethra and where the two ureters enter is right at the bottom. So he didn't destroy that, but he took the top part, folded it over a catheter, and then rebuilt it with my ileum. And this is a lot worse than the Mitrofanoff, but I had a particular situation, and I had a lot of time to recover.
Right. So with the Mitrofanoff, they use the appendix, right? They use the appendix as part of the reworking of it. Right?
Mine was more difficult because I didn't have an appendix.
Gotcha. Okay. So so Kristen said that she doesn't really know. She's just learning about it. So she's just watching this to learn and stuff like that. So, okay. So do you guys have any questions for Doris, you guys, about the mitro?
I do.
Okay, go.
Do you have bad scarring from it on your stomach?
Do I have a stoma?
No, do you have scarring?
Scarring.
Yes. He attempted to, the Mitrofanoff goes into the belly button, and that's where he wanted to put my outlet. But so he cut, and what will happen is you'll have a question mark scar around your belly button, and I do, because he attempted to do that. So that's there. There's a question mark scar around my belly button, and I had a previous suprapubic scar, and that's I'm using the word suprapubic to define location. So there's a scar there where he ended up putting it. My stoma is suprapubic because he couldn't get enough blood supplied to the navel, which is where they want to put the tube. And there just wasn't enough blood supply. It would have been a hell of a lot easier to use if it had been my navel, but I'm capable of using it where it is. So I'm almost, right now where it is, it's hidden. So I'm kind of think it's a better place to put it suprapubic, where it's under the fat that overlays it. And Emily has seen it, but not many other people have seen it.
I learned, but it's not unsightly at all. It's just, it looks like a little slit. It looks like a little belly button. It's not even as distinctive as a belly button. And it's over to the side, right? And I should have taken pictures of it. I'm just kidding.
It's over my left side. It's okay. You should have taken pictures.
But
thank you. We're not
but no, it's like a little slit. It's nothing distinctive. So I mean, it was really easy. And then she just pulled out this, it was like a tube in a piece of plastic. It's like in a wrap, like a wrapping paper.
And then catheter.
Yeah, and it doesn't have a lube with it. It's already lubed up, right?
It's already lubed. Yeah.
Right, and it just comes out of this stuff, and then it's just a tube, and then she just threaded it in, and just pushed the tube in, and it was like tapping a beer keg, and then all of us. Hold on. Sorry, I gotta tell my dad to go away. All right, anyway, but yeah, it was like tapping a keg. She just pushed it in, and then she hooked it up to this little bag. And then all of a sudden, the urine just started to flow right into the bag, and she just picked up got the bag, it filled up, and then she just dumped the urine into the toilet, and then threw the bag away with the tube. And it was just really simple. And then Heather, who isn't here today, but Heather, she peed for me too. And this was the second time I had seen her pee. But Heather basically had, she kind of just leaves her tube out. She doesn't really tuck it in. She doesn't seem to care because nobody really knows. They don't ask questions. but it's just like it was like a little rubber tube, like kind of like a very limp dick, and then it had at the end like a clamp on it, like a flip cap thing. And she just went over to the toilet and she just pulled the tube out, and she can actually pull on it. It holds in. I mean, it's not like a danger. It looks like it's in there on the other end. And then she just flipped the tube and just hung it into the toilet and peed. And then when she was done peeing, she just flipped it back, and that was it.
Heather, an SPC.
She has the SPC.
Yeah. Okay.
Yeah. So Heather has the SPC and Doris has the mitro. So I got to witness both examples, and and so it was really interesting. There was a lot of fiddling with Doris, as far as, because I think you just had like pants to undo, and she had to kind of like lean back. She had to lean her wheelchair back, and she had to kind of pull up her shirt and and get the paper thing and undo the paper and pull out the tube. So there was like there was supplies and a little bit more positioning. Whereas Heather just had it there. She just lifted up her shirt, pulled out the tube, uncapped it, and boom. Like that, there wasn't a lot of stuff. So, I mean, I guess for me, but I liked the fact that when Doris pulled up her stomach, when Doris lifted her shirt, it was like a flat stomach. There was like nothing there, And so that to me, so it was kind of one of those things where it's like, I don't know. I didn't know. And also, I don't know if I'm being like too analytical, but I noticed that like Heather had a lot of sediment in her urine. I really looked. Her urine seemed a little bit cloudier and more full of sediment. And she's actually said that she's had some issues with that. And Doris, your urine was like really clear and clean, but you've been drinking a lot lately.
Well, I've been drinking a lot. I've been putting out. Well, I had been losing weight, and we don't want to talk about that right now. I couldn't do what Heather does. I would be infected all the time, and I don't know how. I mean, maybe she is, and she doesn't know it yet. And if she's got sediment, she's probably got an infection. I even if I had just the suprapubic, I still couldn't. I couldn't pull on it like that. That would just freak me out.
All right. So yeah, that's what I saw. What about you, Kat? Do you have any questions or Kristen? Do you guys? Oh, wait, Kristen has a question. Do you mind if I read Kristen's question first?
Go ahead.
All right. She says, so you only use it when you need to pee. You don't have to constantly have it attached to the bag.
Nothing is touched to me. Nothing is connected to me.
Yeah, and Heather doesn't have a bag. She has a valve at the end that she unclips. Or not unclips, but she flips it open. So she flips it open, and then the pee just starts coming out. So you don't have to have it attached to a bag. Some people prefer to have the bag. Like I know, some people in our group, they have actually like a little, like they've made like a decorative bag cover that they'll wear it on the side and they just let it fill up. I know that when you first get it, like the first month or so with an SPC, you have to have it attached to a bag until your bladder becomes less angry. That's what Allie always says. She says that first month is really like your bladder's really, really angry. And so you have to like kind of let it just do its thing. And then once you can start to feel that it can to be controlled, then you can take it off the bag and switch the valve. But a lot of American doctors don't know what a flip flow catheter is. Like most American doctors, it's not common practice to put people on a flip flow. You have to actually purchase the supplies and kind of hook it up yourself. The doctors will just initially think in the U.S. to put it on to put you on the bag. So.
I think everyone I know in the UK who has it is on flip flow.
Mm.
I don't know anyone who's on the bag. So maybe it's more common over here to be on flip flow. I'm not sure.
Yeah.
Ours are by the NHS. They're like, you don't have to like order it, and so if you just go to the doctors and you can get a prescription. So maybe it's easier to get it over here.
Where do you buy your supplies out of pocket, Doris? Or you said you get a certain amount paid for, right?
Well, Medicare is paying for it. They fight every year about using those touchless catheters. Because they say you have to have two documented UTIs to need them, and it's silly if I were pulling a catheter out of my pocket and sticking it in me, I'd be much more likely to get a UTI. So then I would have it documented and I'd get the catheters paid for again. So right now, I mean, Travis Medical likes me enough that they fight it till they get it paid for. They're willing to go through the fights, but it's a hassle almost every year. I have to call the doctor and say you have to say this. And my doctor has stated, he says to me, medical care is a game, and I will play whatever part I have to get you what you need. So in other words, I think he was saying, I'm willing to say you have a UTI even if you don't.
So, Kat, do you have any questions at this point?
No. At this point, it's just interesting to hear both sides of the story. Yeah.
Okay. And I've done so many of these that I have a very clear memory of what people have said. And so even though they're not here, which really bums me out on the SPC end of things, but I can pretty much answer questions. I feel pretty comfortable at this point. I can also refer you guys to the hangout that we did on SPCs, so you can watch that video. It's actually pretty funny. Did you attend any of those?
I attended one of them.
Yeah, it was the one. My favorite. One of my favorites is really good because I was asking a lot of just really strange questions. I don't know, but it went. I thought it was pretty entertaining and good. And then I also have an interview that I made with my doctor. I went in and I recorded me asking him questions, and so that's interesting. I recorded it on my iPhone, and so I can send you guys through email the MP3 of that conversation, because we talked a lot about the surgery aspect and the anesthesia, things like that. Do you know if in the UK they just do a twilight sedation?
I talked to my doctor about it last week, and he knew what it was, but I think it's quite a new concept because he was like, I haven't really had anyone go under it in twilight before because of our spinal rods, we can't have an epidural. So it'd be anesthesia or twilight. So I want to go. Well, I don't really know because I think I feel a bit funny being awake when they're operating on me. Don't know whether I'd like it, but my dad wants me to go under twilights because it's not as bad as anesthetic.
Yeah, if I have a choice, I'm going to do twilight as well. I literally don't even want to get the IV that they have to put in my arm. I really just wish I could avoid all of it, but I'm getting to the point now where I'm 37. I'll be 38 in a couple of weeks, and I'm just tired. I'm just tired of it. I'm tired of holding my piss. I'm tired of waiting. I'm tired of not drinking water. I need to be hydrated. I live in Texas, and if you don't know what this is like, I mean, it's hot here. You sweat all the time. I'm constantly dehydrated. So I really want to drink, and I'm tired of and with us here, the care hours, we only get it's very rare if you can get over 6 hours a day. And so I only get the option of going to the bathroom 3 times a day. And it's tough. I'm tired of it. I'm too old. How old were you, Doris, when you got it done?
I was 48, and after, when it all resolved and everything came together, it was working for me. I had so wished I did it when I was 22. Or even earlier than that. It's because it's just amazing what else is opened up. I mean, before I had it done, and I was to the point where I would be driving in the car thinking where I was going to go next, and I realized I had to pee, and I thought, oh, hell, you're not going anywhere next, you're going home.
Yeah.
And it's just, that's just gone. I don't have to worry about those things anymore.
Everybody that's gotten any of these things, like, that's another thing. All the people that I've talked to that have gotten either the SPC or the Mitro, all of them said no regrets. Like, they said no matter what they've been through, if it's been infections or whatever, every single one of them said they would do it again, and they were totally happy with their decision. And so that to me tells me that no matter how bad it is, it can't be as bad as what we're dealing with at the moment, because like I guess that's kind of the summary effect for me. Now, I've talked to some people where they're like, well, if it's not broke, I don't want to fix it, and they don't consider the situation they're in a broke situation. Like they're managing what they have, they're doing it, they're able to hold it for 8 hours a day or whatever. And I don't know, how often do you guys go to the bathroom in the UK?
I tend to go in the morning, so probably about 7:30, 8 o'clock. And then I go when I come back from uni, which is about 4:30. And then just before I go to bed, so probably about 11, 12 o'clock.
So about 3 times a day?
Yeah, well, sometimes more. It depends what I drink. Like now you've probably seen I'm drinking Coke, because I can only drink Coke and tea without needing the toilet. If I drink anything else, I end up needing a wee. But then sometimes I have to come home from uni, go to the loo, and go back, which is such a pain.
I know, it is. It's horrible. Like when I went to university to get my teaching certification, I had to commute to campus. I wasn't living on campus for that. And I would be downtown, and I wouldn't be able to take the bus home to my house to meet my attendant. So I actually used the health center on campus. Like I went over to the health center, and the health center actually helped me go to the bathroom. And I don't know how I managed that, but I worked out that arrangement. But it's that kind of stuff where it just really takes it makes your life. Like I have people come to my work now, but for a long time, no one came to work. I would just have to go all day without going. And it's really harmful. It's really hard. So I don't know. I don't know. What Kristen and Kat, what are you guys thinking? Are you thinking more SPC or Mitro at this point, just in this conversation?
I don't know, the SPC kind of scares me because I don't like the idea of having to change the tubing. I am used to tubing because I already have a feeding gastrostomy tube, so I'm kind of okay with tubes, but not changing them. That's the biggest worry for me.
Yeah. So Kristen said, I heard that people with SPCs have a high risk of UTIs. How does that really happen, and can you prevent it? So this is the thing. I know that's this for sure. There is a high risk of UTIs. A lot of it depends on the frequency of changing it. So it's recommended that you change it, I think, every 3 weeks. 3 weeks to a month in the U.S. That's what my doctor told me, is that he wanted to see me changing it every 3 weeks, I believe, 2 to 3 weeks or something like that. So I think the frequency of the change, I think number 2 is partially like your disposition, like your own chemical, your own chemistry in a sense, because I think some people are a lot more, I don't know, maybe their alkaline levels or whatever, like they're a little bit less, it doesn't happen to them as much. And some other folks really do have a lot of issues with that. So if you were prone to a lot of UTIs before getting the catheter, I think it can happen a lot after the catheter. So that's one thing. And then a lot of people say that they drink like a shot of lemon juice. Like they'll take a shot of lemon juice once a day, or they'll try to like change, like basically, like cut back on like the stuff through acid types foods and things like that. And then also just having a very, very clean, sterilized change. And that's kind of coming down to making sure that someone that's a professional, or at least has professional level training, changes it. So those are some of the things that I think prevent the SPCs. And then, and I think like Allie, for instance, doesn't like antibiotics. And so she said that she was just really flushing it a lot, like drinking, throwing in the lemon juice, just doing a lot to just kind of flush it out, cranberry juice, all that stuff, just kind of keeping her levels more acidic. I hope I'm not talking about I think I know what I'm talking about, if that makes sense. I don't know if is that what you guys have heard, or?
I have to throw in that do not, I saw this on the feed yesterday, do not take Levaquin. And if you get a UTI, that's the first thing any urologist is going to give you. So no, not to take it.
Levaquin.
What was that? Sorry, what was that you shouldn't take?
Levaquin, we were talking about the antibiotic Levaquin. It's part of a family of antibiotics. That sounds like that, right? That's kind of how you know it.
It's fluoroquinolones, all of the fluoroquinolones, all of ciprofloxacin, Levaquin, anything that has the quin or a Q in the trade name is probably one of those drugs.
But it basically, it makes us weaker. It can really, it can make us permanently weaker. It's a very dangerous antibiotic. And we were talking about the majority of people on Living with MD that have taken it have gotten serious side effects from it, that serious weakness. I took it, I got very weak. I don't think I've ever recovered. And it messed up my stomach as well. I think I've had a lot of digestion issues since it. But a lot of doctors don't know that we can't take it.
No doctor knows, and no doctor will tell you. I mean, the one I had a physiatrist finally admitted to me, and he told me don't take mycin drugs either.
What? Oh, really?
Yeah, and I have I've had eye infections, and the only thing they have for eye infections are mycin drugs, and I can tell what it does even just putting it in my eye. What
is like erythromycin or Maya?
Well, now this particular doctor said erythromycin was okay, but any of the derivatives are not.
Really?
Yeah, like what?
What do they do?
It makes you weak.
Yeah.
He said he's seen people with post polio on a vancomycin drip for some infection, and then people that were basically ambulatory, not being able to get out of bed afterwards.
Really?
And I can tell what it does to me is gives me a really bad headache and just kind of makes me feel bad.
Yeah.
So I put that on my no list.
So you said that when you first got your mitral, you did have a lot of infections. How did you eventually get rid of the infection stuff?
Finally, my doctor said, why don't you try this? And it's an old drug. It's called, now I'm not going to think of the name. Methanamine hippurate. And it's not an antibiotic, it's an antibacterial. And it makes your urine inhospitable environment. And since I've been on that, I've not had a bladder infection. If I've had I had a bladder infection right after when he opened it up again for me in January. Well, okay, yeah, I had a lot of foreign hands in there. And that's the only bladder infection I've had that the methanamine didn't catch, and didn't just I'll feel one coming on, and I'll just up my dose of methamphetamine, and it seems to just go away.
And how do you know you're feeling one coming on?
Well, it starts to hurt.
Yeah.
And you'll want to pee more often. You'll feel like you have to pee all the time.
Oh, and that's all right. So she says, Kristen says, I get UTIs about 3 times a year, but I currently wear pull-ups all day, so I think that's why I get them. If I had an SPC, I probably wouldn't get them as much because I wouldn't be sitting in a wet pull-up when I'm out of the house, right? I would say, I imagine that there could be a lot of issues by wearing them. Like that it's not probably good to be sitting in them, that bacteria-wise. So I imagine, I don't really know. I don't know the answer to that. Does anybody else have any thoughts on that?
I would think that would lead to a lot of fungus infections.
Yeah, because I think in a way, like SPCs kind of start inside. They're not necessarily, right? Like it's more of an internal start than an external issue.
Oh, the UTI?
Yeah. Well, I don't know about that. There's bacteria and stuff. That's why they always tell you to pee after sex. I don't know.
Yeah, that's what I was thinking.
I don't know. I don't know. I think that as far as like your independence goes and your overall, I know that wearing a pull-up would be really rough. It would be really hard for me to sit in a pull-up all day. I think that's, I think that, having that freedom and not having to worry about it, I think that would be my number one reason. Like, I know that I'd rather have an SPC than a pull-up. That's for sure. That's for sure.
Can I just ask what those antibiotics were again? Because I want to write them down. What we shouldn't have.
Yeah, I'll type it in the chat. Can you see the chat?
No.
At the bottom of your screen, there's a button that says chat.
Yeah.
And Doris, can you write the name?
Gosh, I'm such a horrible spelling.
I'm stressing out now because my doctors have always given me clarithromycin when I've had chest infections. If I've had them then if I've had that for 2 weeks, they'll give me clarithromycin to take me off the amoxicillin. And I'm a bit worried now that I've got that on my records because it's making me weaker. I don't want it anymore.
Well, do you feel weaker when you're taking it, though? You'll notice it right away. Like with Levaquin, which is a frequent thing that's prescribed, like that's what we were all talking about, is like most of us stopped using it right away because we were like, holy crap, like there was a huge, huge drop. You feel it.
Well, it made me really like sick, and like it made me feel sick and it made me feel like tired, but I just assumed that was just like a normal side effect because they do say, don't they, that antibiotics can make you feel sick.
Right.
So I assumed that it was the sickness that was making me feel weaker because I was constantly being sick.
Mm.
But now I'm not too sure. It could have been that was the side effect and not the sickness.
Let me see what's going on here. I want to see if I can find that. I read about Levaquin that we were all talking about. Oh yeah, there you go, Doris. Thank you. Oh wow, I didn't know Cipro was a problem.
It's the same thing. They're all the same.
Interesting. And could you type the name of the drug that you take to make your bladder more?
I forgive that I don't know how to spell things. I'm getting.
Mm-hmm. I'm trying to find it. It's amazing. Yeah, there we go. I'm going to actually tag you in the post, Marnie.
Okay, thank you.
Do you guys want me to tag you in the post about the antibiotics?
Yeah.
Okay. Kristen, what's your last name? methamine hypipurate.
Well, let me try that again. Phantom, there's another N in there. Phantomine.
I don't know which Kristen it is. Is it Kristen Milifchik? Milifchik? I don't think it's still Dunleavy because I met her the other day. So, or maybe it's a Kristen from another group. But anyway, I tagged you on. Oh, Dugan. So you must be from a different group then. Maybe you're. It's nice to meet you. So, yeah, I just need to bite the bullet and just set up the appointment and just do it. I just got to do it. The thing is that I just don't. So the recovery time. What exactly were you doing in rehab for the time that you were in rehab for the month?
Oh, well, I was learning how to use it. I was getting used to it, and I was getting pissed off at nurses a lot too.
Do you feel like, were you in bed a lot of the time recovering? I mean, were you sitting up or were you mostly laying in bed?
No, they got me up pretty quickly. I was in bed. Well, I wasn't, because I had a wonderful physical therapist meet me at, showed up in my hospital room and got me out of bed like 2 days after the surgery, because he brought a chair that just fit me wonderfully and kind of gave me all kinds of support, but it got me sitting up, which I think was really important to recovery. So I was out of bed actually at Seton and the real hospital a lot easier than I was in rehab, because they didn't have all the equipment at rehab. But they transferred me to rehab and they couldn't get me out of bed till the next day. But I was begging for a shower, because that was the one thing I couldn't get at whatever Seton is called, the real hospital. And at rehab, I got a shower the next day, and from that period on, I was up and in and out of physical therapy and just moving about the hospital. I mean, I didn't have a lot to do. I had people bring my mail to me, and so I was trying to keep up with things at home. The internet wasn't like it is now, so I didn't have much other than television to look at. But now, good Lord, there's so many things to do.
That's interesting, because when I was talking to another person that had the mitro. She was supposed to come in today, but I guess she wasn't able to. But this is what we had a brief conversation about it, and she said she was in the hospital for only 5 days, and then she said she has to have a Foley catheter and a tube in my belly button for 4 weeks after. So she said so she's actually getting the Foley and stuff. She's actually going to start using it on Wednesday of this coming week. And I asked her if she was in a lot of pain, and she said very little. I was only on morphine for 3 days and Advil after that. I haven't taken Advil after the first week and a half. It was a little painful to roll in bed and bend for a bit, but I'm sure that can be expected of any surgery.
What's Advil? Is that like paracetamol? Is Advil like paracetamol?
It's like Tylenol or Advil. Oh God, you guys have totally different drugs. Do you have Aleve?
Have what?
Do you have like an ibuprofen or Aleve or?
Ibuprofen.
Yeah, it's like that. It's like a over the counter like pain reliever that people take like candy sometimes. But yeah, no. And she said she was on morphine for 3 days though. That's heavy duty. But
I was on morphine, I think, a little bit longer than that.
Okay. Well, sounds like you had like a lot more to do.
Well, he, what he tried to do, he couldn't do. So he kind of had to back out and change what he was headed to do. And plus, it was 2001. So
Right.
I think they know what they're doing more than they did then. But
Right.
I couldn't wait.
I agree. I think that it's probably a little bit, well, I think personally because you didn't have an appendix, and that's really how it's done now. So like the procedure itself, I think that it would be probably more, it wouldn't be a month, but I bet it would at least probably be a week of maybe being in the hospital, and then another week of just being at home resting, and then according to her, you can't even start using it for another a month and a half. So that was kind of interesting.
I was able to use it. It was difficult learning how to use it, but he pulled the Foley pretty 3 weeks, I think. It might have been 4 weeks, but my memory's saying 3.
The Foley is like that, the one that's like down there. If that makes sense. Can you sit when that's in with the Foley catheter?
Yeah.
Yeah.
If it's in your urethra, you mean?
So one of the other girl was saying how when she had the mitro fitted, that she had this tube in her belly that went to the mitro, and then the other one for like a couple of weeks. Can you still sit with that in?
I don't know. I think so.
Yes, you can.
Yeah.
Because I used a Foley in my urethra leading up to getting the surgery, and I could. It's uncomfortable in a different place. The place that it hurts is further inside than what you're sitting on.
Okay.
I'm a little concerned about my lift. I do a pivot transfer lift, so I don't get picked up like a baby. I get kind of, my stomach and gets kind of squished when I get lifted. That's another thing I'm kind of nervous about with the SPC, is I don't want to put any weird pressure on it while I'm transferring. That is one thing I'm a little worried about, and no one seems to understand if it's going to help. The doctor says they can't guarantee where it's going to be placed because they have to they said it'll be somewhere below the belly button and over the pubic bone, but they don't know exactly where, because he just has to kind of feel out my system. So Kristen said that.
Just a question.
Yeah, sure.
Sorry for it. Is this going to be online later? Because I have college tomorrow morning. So I have to go get ready for bed and stuff. Is this going to be online afterwards?
Yeah, and the other ones are on there too. So I will definitely. So I will link to the. I'll send you a link to the YouTube video of the other SPCs things, and when it comes up, it'll be on there too.
Oh, okay.
Yeah.
All right. Well, I have to go now, but
wonderful meeting.
It's interesting to see what other people say, and yeah, thank you.
Thank you. All right. Talk to you later. Have a good night.
Thank you. Bye.
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 So, and just Kristen was saying that her stomach gets squished when she gets picked up too. Surgeries don't bother me anymore. She said she's had so many. She's like, yeah, whatever. Well, yeah, and I mean, that's the thing. I think that in a way that's a good thing to have that kind of experience for sure. I don't wish I had more experience, but I do, because then I would have freaked out by even just an IV.
I've had like a autocath fitted, which is instead of going into your veins, which I'm just about to have taken out, because as soon as I transferred into adult services, there was no one to flush it. So it's got blocks. So that's why I'm a bit worried about the SPC, because if there's no one to change it, then I'm going to be buggered. So,
I mean, the thing is like, I know people that have taught their family and friends to do it. My boyfriend said he would be willing to learn how to do it. He's very sloppy at times, so I'm kind of nervous about him doing such a specific procedure. Not that I don't trust him, but I don't know.
Over here.
Huh?
They're a bit more strict over here.
They are?
So, like certain, like, well, one of my PAs has an MVQ level 2, which allows her to flush porta cats, but then I couldn't get a prescription for the drug that had to go in, because if you use it too much, you can get addicted to it. So they wouldn't allow a prescription that wasn't being used by a professional, because then it wasn't monitored. So
wow.
a little bit more strict over here.
I got you. I'm surprised you have a porta cat. What kind of medications are you on?
I'm not on any, but when I was younger, I literally had like no veins in my hands because I'd had that many IVs in my hands. They'd all broken down to capillaries.
Oh.
So it was an absolute nightmare. And I was in hospital at least once a year with a chest infection. So they put it in to take the stress away of getting an IV in. But I haven't used it, touch wood, I haven't been that poorly in 4 years now. So they're like, well, your veins are okay and you should be okay to have it taken out. And then they weren't going to do it, so I just stopped getting it flushed. So, because they were flushing it, but they weren't flushing it, if that makes sense. Like, I'd go and they wouldn't have the stuff, so I'd have to then take another day off uni and go again. And it was a complete mess around. So I just got blocked, so they'd take it out.
Gotcha.
They wouldn't have left that in here. They wouldn't even let me keep the porta cat after my major surgery for a day. After I got into rehab, it was pulled. And one day later. I think it was even that night. I think it was within hours they got that thing out of me.
When you had yours taken out, were you put under? Or were you just
cold? I think it was a simple central line. So
okay.
Yeah.
No, mine's under the skin. So
okay. Yeah, that's more involved.
Yeah, it's a pain. It was good when I could get it flushed. It was great. Now it's just a pain. So.
Yeah.
But that's why I'm a bit worried about the SPC. Because if there's the same attitude about flushing the porta cat as there is about changing the SPC, then I'm going to struggle. So, I don't know. So when you had yours done, like obviously I'm at uni, do you reckon I'd still be able to do my work while I was recovering? Or would I need complete time off?
You'll need a little bit of time off. You probably won't need as long as I needed. I had time. I had already retired. Yeah. So I had plenty. I wasn't fighting to get home, except there at the end I told them that I wanted to leave before they were ready to release me. I said, I'm done. Let's go. Let me go. And they did. In the United States, it's when your Medicare payment is up, you're well. And mine wasn't quite up, so I wasn't well yet. And I said, no, wait a minute, I am well. Let me go. And they weren't going to fight that. So I don't know. If I'd been anxious to get back to work, it might have gone quicker, but it wasn't until I was just anxious to get home and sleep with my very own cats that I fought it and came home. I mean, I had parked my van outside the rehab hospital.
Yeah.
When the last week came, I'd gotten someone to bring my van to me, and I left it outside the rehab hospital several days before they released me. So it wasn't, I was free to go. I had transportation. I could have just walked out the door, except they would have been calling me.
So, yeah. I don't know. It's a debate. It's a debate. I was going to do it a while ago and I didn't. I checked it out. So
I'll say what my primary care doctor said to me, because I went back to my primary care after seeing the urologist to ask her what she thought, and she was just kind of blown away by the whole thing. But in the end, she said, "You're not getting any younger. Do it."
Yeah.
And that is the thing. I mean, I was 48 at the time, and I certainly wouldn't want to do it now.
Yeah. See, I'm wanting to do it now for my hydration. Because I'm getting bags under my eyes already and I'm only 20 from dehydration. So.
No, water helps. Do you drink a lot? I mean, did you drink a lot of water when it was, all said and done? I mean, are you taking advantage of it? Do you drink?
I drank so much water right after it was done. I thought I would never stop drinking water because it was such a treat, and right now I'm kind of lazy. Right, I should have water next to me right now, and I don't.
I imagine that I'd be drinking all the time.
I am drinking 6 glasses because right now, since I'm on this crazy diet, I'm marking down every glass of water, and I am drinking 6 glasses. It's not the 8 that they tell you to drink, but it's better than what I was drinking.
I do.
All right. Oh, so let's see. Kristen said, "Can you send me the link to the online stuff? This is very educational. Thanks for setting it up." No problem, Kristen. I don't think I have your. I don't know if I know you. Can you PM me on Facebook, and I will send you what you need. I don't see you on the list for people on Living with MD, so I don't know.
She might be from Smarties.
Yeah, she might. Yeah, we'll get it to you. No worries. Thank you for coming. Okay, so, all right. Well, does anybody else have any more questions, or?
Can I just ask one more really, really quick?
Absolutely, take your time, sure. Well, I mean, Doris is answering them, so I don't. Yeah.
You don't have to answer if you don't want, Doris, but have you got strong upper body strength to be able to put the tube in, or quite medium upper body strength, or like
not that much. I can, that's about it. But I don't know, Emily, am I stronger than most people? I compared to a person without NMD, I'm really weak. Yeah. Compared to some people that I've seen, I am stronger. Okay. It hasn't, but it's like it's something I do 5 times a day. So it's just I would know if it were getting harder to do, and it does. I mean, it does scar down some, and it gets more difficult. But they can take those scar tissue out. I don't know. I don't know how to compare myself with others.
Yeah. Thank you.
Well, she's Doris. I think I don't know if you look at us. If you put us next to each other, I don't know. I don't know if we were in a fight, like a physical fight, who would win. I don't know. I don't know. Who could kick each other? Who would kick each other's ass?
I don't know. I think me and Nancy, we're alike, and I've said to Nancy, "What do you think is the difference?" Because some people have, Nancy and I are like overweight and fat, and other people are so thin. And no one's ever explained that to me. Why do we have?
I know. I don't get it either. No, I really believe this. I wanted to suggest this on Living with MD, but I wanted to get pictures of us and do some kind of categorizing based on physical characteristics and see, because I almost feel like the type of SMA has to do with like the physical characteristics, because I've gained a lot of weight since I was more like, I used to be more like Marnie, and now I'm getting bigger. Like I'm getting a lot bigger. Like, and I'm gaining weight like crazy, and I'm not getting rid of it, and it's really weird. But anyway, no, I think it has something to do with like, I think that there are certain types of SMA that are stronger. Like it's just a different thing. I don't know how to explain it. I don't know. All I know is that like I'm pretty weak. What is something that, okay, let me think of something that we could compare it to.
Could you like brush your own hair?
No.
No.
Oh, I can.
You can?
But I can't do any styling.
Yeah,
And-
that's not me. I can like lean and brush my own hair.
I can do that. I can do that.
Pull it up into a ponytail.
I can, no way. No way. All right, that's a good one. That's a good comparison. What would be another one? Can you do the, can you unbutton your pants?
No.
Not at all. No, I can unbutton my pants.
My fingers are quite weak, so like my fingers are a lot weaker than what my arms are. Like if I put my hands up, I'm like constantly in claws. I can't straighten my fingers.
Oh.
I can do that, but I can't like straighten them up.
See, I've got but I can't.
I think that might be from like drawing all the time because I'm always holding pens or paintbrushes, and I'm a bit ambidextrous, so I use both hands.
Mm-hmm.
And I think because I never do that because I'm always drawing, I've lost the ability.
But see, your hands look a lot like Kareen, and Kareen is my best friend with SMA. And you have a lot of characteristics of Kareen. Like I look at you and I see the hands. She has like the same hands. But I don't know. It's just interesting to me. I think there's something. It has something to do with physical characteristics. I really do. I think our types are tied to that.
Do with muscle mass.
Mm.
My shoulders are absolutely tiny because I've got no muscle there. Like, I can't lift my arm up. Like that's as far as I can go, and I'm leaning to do that. Like I'm using my hips to do that. I'm not lifting my arm.
Yeah, I can't. Like I can do this.
Yeah, I can't lift my arm. I can't lift my elbow up at all.
See, Doris and I were I think Doris and I would be a really good fight. We'd be like a really good boxing match. Like,
if I use my other arm, I can like lift it, but I can't do that without using my other arm to support it. If that makes sense.
Yeah. Interesting. I don't think that you're. I don't know.
When I was younger, I was on the upper scale of type 2. Like I could like hold onto the sofa and walk along it. But now I'm like in the middle. Like so yeah, I've like lost quite a lot of strength.
Mm-hmm.
So
And Emily, you know, when I lost 20 pounds, I gained strength, which to me just was so surprising. I didn't know, and nobody can. I don't have an explanation for that, but I'm glad.
I need to look into it.
I think I lost muscle when I lost weight. Because I was quite chubby before I had my back surgery, and then I got a little bit silly with my eating.
Well, may I ask how much you weigh?
I'm under 5 stone.
Well, I don't know what's that mean.
I don't know what that. Wait, I'll use a converter on my phone. I'll get a converter because you do it in pounds, don't you?
Right. Yeah.
I'll convert it. 2 seconds.
I can convert. Well, tell me what the conversion is, or I'll tell you what my conversion is, and then I'll tell you what I weigh, and then you can convert me to you.
Okay.
All right. Let me know.
No. Oh, that was just confusing.
I'm guessing it's 60 pounds.
What?
I think you've guessed right. I've just done 5 stone, and that's come out as 70 pounds. I'm just under 5 stone.
Okay.
So, yeah.
I'm about twice as much as you.
Okay.
That's how much I weigh. I'm about, I think I'm 136 pounds.
That's healthy though. I'm always nagged by my doctors to gain weight.
Yeah, but I think there's a point where it really, like, just as there's a point when you lose weight where you start to get weaker, there's a point where you gain weight and you start to get weaker. There's a nice, like, healthy middle point, I think. I think about 100 to 110 pounds is a very good weight for us. See,
I'm just conscious of my stomach because, like the SMA belly.
Mm-hmm.
Mine's pretty bad. So, because I lean forward quite a lot. So I'm just conscious of that, which is why I don't like to gain weight.
Yeah.
I constantly get nagged by doctors.
Where are you at now, Doris? How much do you weigh?
Oh, gosh, I'm so mad about this. I'm circling 140.
Yeah.
And I'm still trying to diet, and it's not coming down anymore. And that's a long story. The coach almost tried to kick me off the program, and I kind of pulled a "you're doing that because I'm disabled" number on her, and and now I'm stuck.
Oh no. What do you mean, you can't get on the program anymore, or?
Well, she couldn't get me off because she knew that was an ADA lawsuit standing in front of her. She kicked me off, and the doctor didn't want me to go to leave it, so she couldn't get rid of me. But I think she basically she didn't know what to do with me because, I'm different from everybody else, and I don't know. I told her my end date was going to be June 14th, and so since I'm just circling 140, I go from 137 to 142 in a week. and back.
Oh, no.
It's hard, though, because we can't exercise.
No.
To a certain point where, because obviously, like, when you, like, my parents always said, when you, like, need to lose weight, you lose it quickly, and then you slow down and down as you need to lose less and less weight. Which is when if you want to keep losing rapid weight, you have to exercise. But we can't do that. We can't exercise.
I know.
You're going to get slower and slower and slower if you, So, but I just stopped eating. And that's how I lost my weight. And then I got shouted at and got threatened with a peg. So, don't do that.
Yeah.
I really love to eat. I really love to eat.
Oh, lady, I'm sorry you're having a hard time. Well, I
found this really useful, so I'm glad you've done it.
Well, good. Thank you for coming.
But it's interesting about the appendix thing, because when I had a scan, because they thought I had appendicitis, they couldn't find my appendix, so they don't think I have one. But I haven't had it removed. So
they lost it?
No, they couldn't find it. I knew it wasn't appendicitis because they put me on antibiotics that I knew I was allergic to. But they wouldn't listen to me because doctors know best. And then they did a scan for appendicitis and couldn't find my appendix. So I don't even know whether I've got any.
Wow.
Do some people not have them? Are they like evolving away or something?
Well, they're not really, like, doctors are saying they're not like a necessity for your body, are they? Like, you don't really need them. So as, like, people evolve, they might start being born without them. So I might be one of those people.
Wow.
So that might make the Mitrofanoff surgery a little bit more complicated for me.
Well, yeah, you might be along the lines of the Doris. You might have the Doris situation.
Yeah.
All very interesting.
Yeah.
Well,
have another scan to try and find it before I saw.
A bunch of people on Living with MD said that if they had more direct notice, they would come. So maybe we could do another one at some point this summer.
Yeah.
And see if more people can show up. I just think I keep doing this topic because I really think it's really important. And we want us to be as informed as we can. So.
Especially when you're going to go on to go to surgery, like you want as much information as you can possibly get before making a decision.
Right.
It's
Right.
not an easy decision to make, is it?
Right. So yeah, Marnie, if you want to send me your email, I can email you.
I'll put it in that chat now.
Huh? Oh yeah, we are in the chat. Okay. I'll just throw that in there.
Yeah, I'll put it in now.
I need your email though, so I can email you the recording. So.
Yeah, I'll put my email in.
Okay, sounds good. All right. Well, I guess I'll talk to you later.
1 second. I've got my email address. I've got a new email because my old email was like my MSN one that I made when I was like 12 and it's really embarrassing. So I'll just find my email. Wait, it's here.
So you're coming to Central Market, Doris?
I am coming to Central Market in 2 weeks.
Not next week, but the week after.
Right. I'll bring my vegetables.
Right on.
My email should be in the chat, I think, if I've done it right.
I'm going to stop the recording just because we're just talking about whatever. So hold on.